Today, Americans are enjoying longer, more active lives than at any time in history. However, as we grow older, our bodies do begin to change. Many individuals experience painful problems with their joints, sometimes so severe that performing even the simplest daily activities can be difficult. Here to talk about arthritis and treatment options that can result in a return to a normal lifestyle and eliminate pain is Dr. Brett Smith with Andrews Orthopedics and Sports Medicine Center. Dr. Smith, thanks for being here.
Thanks, great to be here.
Well, it's always good to have you. So tell us about the prevalence of arthritis in the senior population.
It's huge. You know, as we're aging and growing older, our joints break down. That's part of the arthritis process. And typical joints like the hand that get arthritis, you know, patients can't open jars. They have pain opening jars. Their hips and knees get arthritis. They can't walk and do the activities they want to do. They can't even finish shopping sometimes. So it's a huge problem for them, yes.
Now, is this a problem that sets in when someone is an older adult, or does it start in their 40s and progress, or is there one size fits all?
Yeah.
Tell us a little bit about, you know, how the situation gets to a point where they would actually want to seek medical treatment.
Well, everyone's different. Traumatic events such as sports injuries can cause arthritis to start earlier in the 40-year-old patient or 50-year-old patient. But typically, the seniors are the most affected by these arthritic conditions. Now, rheumatoid arthritis and other immunologic conditions can lead to it sooner, and they need to seek help sooner. But for the most part, the thing they can do, which is the best, is stay active, exercise, continue to use the joints that cause pain, because if they don't, they'll actually end up losing motion, having more pain and more problems.
Well, physically, what makes seniors more susceptible? Is it breakdown of different tissues, or I mean, how does it work?
Yeah, yes, that's correct. You know, arthritis by definition is inflammation of the joint, and the most common type of arthritis is osteoarthritis, which means with age your joint breaks down. So they are typically the patients affected the most, yes.
Well, what about male and female?
More commonly it's females with osteoarthritis and rheumatoid arthritis. Males typically get arthritis as well, but mostly secondary traumatic events more commonly.
Well, you mentioned hands, but what about like hips, shoulders, knees? How are they affected, and why might these different parts have this issue?
Right. Typically the hip and knee are the weight-bearing joints, just like the ankle, and they're seeing 3 times your body weight with each step, so they get arthritis sooner as opposed to the hand, which is not a load-bearing joint per se. When you're walking on it every day and 3 times your body weight is on your hip and knee, it tends to wear away faster.
So if all of these are different, then obviously they're treated differently, is that correct?
Correct, yes.
So, like, and what about shoulders?
Shoulders, typically it's patients with rotator cuff pathology, which is a whole separate topic.
A big word.
Yeah, how did I say that again? But they get arthritis as well. It's a major joint. It's not load-bearing in terms of you know, putting your weight on your shoulders, but certainly the shoulder is the most has the most range of motion of any joint in the body, and because of the range of motion, it is prone to arthritis as well.
Well, what can happen if someone does not seek treatment? I know sometimes when things progress, we've just lived with it for a certain amount of time, and yes, it gets a little worse, but we've just put off seeking treatment. But why should someone not take that way?
Well, the end result of arthritis is a fused joint. So patients with arthritis of the knee that gets so bad, their knee actually becomes stiff, becomes flexed, and so their leg is shortened, and they'll have more pain, less motion, and more disability if they don't seek treatment or help.
Well, what kind of non-invasive or non-operative treatments are available? I know everybody would probably prefer to go that route.
Well, I'm a surgeon. I can't say that. No.
We'll get to operative next.
Okay, fine. That's fair. The first thing to do is stay active and exercise. Keep their weight down, eat healthy, and take anti-inflammatories. The next step, which we can offer, you know, in the office, are injections, different prescription medications, and that's pretty much the non-operative treatment.
Well, when people think about exercising, I know a lot of people may think about walking or jogging.
Correct.
Because of the load-bearing aspect, should they be seeking other types of exercise?
That's a great question. Walking is perfect. Swimming is perfect. Cycling is perfect. Running, unfortunately, is 7 times your body weight on each joint in the lower extremity with running, which is a huge number. So if you weigh 200 pounds, that's, do the math for me, 1,400 pounds with each step on your hip or knee. So that's a tremendous amount of weight. So I don't tell the running wild folks, but I would tell people to avoid running from my standpoint.
Well, what about like exercise machines at the gym?
They're excellent. Now, again, from my standpoint as a hip and knee surgeon, you know, squats are bad, leg presses are bad, but the typical circuit machines are excellent, yes.
Okay. Well, what about if it does get to a point where surgery is needed? Tell us a little bit about the treatments and procedures that are available these days.
Right. The simplest of treatments, from my standpoint, is total knee and hip replacements, and they've gotten so much better in terms of the design of the implants, the surgery itself, the post-operative care. You know, we're actually looking at outpatient surgery now with regard to hip and knee replacements, as opposed to the days before where they were admitted for 5 days and stayed in the hospital for 2 weeks. And that wasn't that long ago, honestly.
What are some of the concerns that patients may express to you, like they just hate to do that?
Right, and it's a nervous process. I mean, it's surgery, and there are complications, and so we talk them through it. The key, though, is we have a huge team at Baptist and our office staff that teaches patients ahead of time. Here's the course you're going to go through. Here's what you're going to expect and what should happen. And I think part of the process is not a part, all of it's explained ahead of time, so their comfort is much better.
Well, what about feedback after the fact? Is, they made that decision, they did it, and what do they tell you about the way they're living their life today?
Oh, they all hate me. No, no, they do tremendously well. Actually, studies have shown that cardiac bypass surgery has less of an impact on patients than hip and knee replacements. So if I replace your hip as opposed to do your heart surgery, you're going to do it better throughout life. It's pretty amazing when you think about it.
So is this something that may need to be looked at, say, 5-10 years down the road, or does this pretty much solve the issue?
No, I think the issue isn't solved. We're certainly improving things, but I think it's a great option for patients if everything else has failed.
Okay, great. Well, if our viewers want more information, is there a phone number or a website they could visit to find out a little bit more?
Sure, yeah. We have our phone number, which is 850-208-6480, and I have my own website, which is brettsmithmd.com, which has links. Sorry.
Great.
And then the Andrews Ortho is also our website.
Well, great. Well, thanks for being here. We appreciate all the good information.
Thank you.
Thank you.